evening, lovely viewers, and welcome back to another episode of The Consulting Room. The Consulting Room comes off every Monday from 8 to 9 p.m. live from the studios of Hope Channel Ghana, and we bring you all the latest updates on health that you need to know about. I'm Dr. Na Ayikako Inen. The body is an amazing creation. It has different things that make it work the way it should. So you have different cells, tissues, organs, systems, and they all work together to make sure that your body is healthy. One of those very important organs is the liver. You've probably heard about it. And tonight is all about liver health. We're going to learn what the liver does, why it's important that your liver is healthy, how do you know your liver is healthy, and if it's not, what do you do about it? So tonight we're talking about having a clean and healthy liver. And if you're a loyal viewer of The Consulting Room, the guest I'm going to introduce is no new person to you. So in the studio with me, I have Dr. Kweku Animedu, and he's a medical doctor with the police hospital. Kweku, you're welcome.
Thank you very much.
And then we have a very special guest joining us tonight. She's Francisca Kusiwa Yeboah. You know more about her when she speaks, but she's a founder of a special organization, and she's going to tell us more about it. Francisca, you're welcome to the show.
Thank you, Abigail. Thanks for having me.
Okay. So we'll go for a quick commercial break, and when we get back, we'll start our conversation. Please stay tuned.
I am an angel of hope.
I'm an angel of hope.
Ubrenio, so do Sika a Baba Hope Channel. No, so ya sene, yet me the mere some a main chia saw in Turumiana, Wadaroma, Farmain, Nafa Sika Fasubi, na also Fabra, Yanko Kanyamsem, and ya cra a wonkwa. Star 928 star 34 star 104 hash. And I say 0249 193083. Hope Channel, yes, Sabrabo. Hope Channel, ya Gia Kranomqua.
Welcome back to The Consulting Room. Tonight we're talking all about the liver, having a clean and healthy liver. If you have any questions that are bothering your mind, you can send them in on our various social media platforms, Facebook, YouTube, and then WhatsApp as well. We'd love to hear from you. So, Kweku, you're welcome again.
Thank you very much, Anna.
We're talking about the liver. What is a liver?
Okay, so when we say the liver, we are talking about the second largest organ in the body, second to the skin.
Okay.
Yes, and it lies at the right upper quadrant of the abdomen. So if you divide the abdomen into 4 quadrants, or even if you decide to 4 quadrants, it finds itself at the right upper quadrant. If you divide the abdomen also into the 9 quadrants, it will start from the uppermost right quadrant and then extend into the upper middle quadrant, where it shares borders with the kidneys, the spleen, the spleen as well.
Okay, yes. Okay. So what does it do for the body?
Okay, so the liver has so many functions of importance to us. Some of the functions include the production of cholesterol.
Okay.
Yes, it also produces bile. Bile is what is used to emulsify fats.
I thought cholesterol was a bad thing.
There are good cholesterol and there are bad
Okay.
cholesterol.
Okay.
Yeah, so it emulsifies fat. It also produces what we call bilirubin. Bilirubin is what gives urine its characteristic color and also
Okay.
feces its characteristic color.
Okay.
But in excessive levels is what we call jaundice. Okay, it's also responsible for the production of some vitamins, some enzymes,
Okay.
as well as some amino acids of importance. Some of the clotting factors also are produced by the liver. Any food we eat through, in terms of the storage form of most of the food we eat will be converted to either glycogen or fatty stores, all in the liver.
Okay.
Yeah, so the medications we take too are also synthesized by the liver. It tells you how important,
Yeah.
the liver is to
Yeah.
us. Yeah.
Yeah. So, looking at how important this organ is, how do we make sure that it's working the best way that it should?
We just have to keep it healthy. That is the point. So that is why we talk about trying to eradicate the risk factors that predispose one to liver diseases.
Okay.
So what we can do by improving the liver health includes we found out that obesity includes one of the risk factors that predisposes one to have a bad liver. So
Okay.
if we talk about obesity, you try and cut your weight loss.
yeah.
Okay. When you talk about dyslipidemia, abnormal bad cholesterol levels, you try and cut that one. Also, you exercise regularly.
Okay.
You also try and avoid certain unprescribed medications, and also as well as illicit medications. Also, when we talk about these medications, we are also talking about herbal medications, especially for herbal medications where you do not know how the preparations have gone. Even normal medications we took over the counter, I will not mention it here because before it scares people out. It's one of the most common medications available. Is one of the things that causes liver disease a lot, especially when you are smiling because you know what I'm talking about. But the point is, you try and take it in moderation so that it doesn't affect the liver. And also, you also try and some form of mushrooms, which produces a lot of aflatoxins, also have a predisposition to liver. So you try and avoid all these things, cut down, eradicate the things that predispose the liver into having bad conditions, bad sexual practice in the form of hepatitis B and C and all those things. Yeah.
Okay. So you've started already. I was coming to ask you, the next question is, what diseases can affect the liver?
Okay, so when we talk about the disease of the liver, we talk about certain conditions that predispose or prevent the liver from functioning as it's supposed to do. This includes the viral causes, what we call viral hepatitis. So hepatitis B, hepatitis C, A, hepatitis D, hepatitis E. In some situations, to what we call cytomegalovirus, HIV, Epstein-Barr virus. These are all lot, and also some parasitic infections, right?
Okay.
Like in the form of malaria itself, amoeba, all those ones are there. And also, you could also have the alcoholic liver diseases, where excessive drinking of alcohol, high storage of iron in the form of what we call Wilson's disease in the form of copper, high deposits of ions. These ones are all things that can predispose one to liver diseases.
Okay. So I'll just
and to add to biliary diseases as well.
Okay.
Yes.
Okay. So I'll come to Francisca shortly. No, I'll come to Francisca now. So I can see something written in your T-shirt.
Yeah.
Collins
Healthy Liver Foundation, Ghana.
GH. Okay. So if you can tell us what this foundation is about.
Okay. So Collins Healthy Liver Foundation Ghana, in short, CLIF-GH, is a non-profit health organization that sets out to educate people about liver and its related diseases. Okay. And then for us, we are currently focusing on the deadly hepatitis B, which has over the years been a headache for most people. It has taken the lives of loved ones. It has actually destroyed the lifestyle of other people, especially those who do not die immediately the virus is detected, and it's caused a whole lot of havoc in families. Okay. So we decided that we have a larger conversation on it. Well, as the name suggests, it was founded in honor of my late father, Elder Collins Yabwamenu. Okay. Unfortunately, in 2022, when the world was dealing with COVID-19, we also had our fair share of grief, which wasn't caused by the COVID-19 virus, but by hepatitis B. And in our case, it was as a result of late detection of the virus. And then I believe that if we had prior knowledge or enough information or knowledge about hepatitis B, perhaps the death could have been prevented. Yeah. So we need people to know that you don't need to lose your loved one because of something that could be prevented. And then for others, even if you do not really care or you think you don't care about your life, other people care about you so much. People would suffer if you no longer exist. So if there's a way to prevent that, let's have the conversation. Yeah. Let's try to eliminate it.
Okay, so that's exactly what we are doing tonight. Yeah. We're talking all about the liver. Okay, so quick, I'll come back to you. Someone has liver disease. How do we know? How does a person present?
Okay, so as we usually will group it signs and symptoms, right? So the symptoms usually are the things that the patient will complain of. And the signs are what your prescriber or your prescriber will pick up on physical examination. Yeah. So for the symptoms, usually people would begin to complain of unusual fatigue, some sort of anorexia, nausea, to some extent vomiting. They also weight loss to some extent. Some of them will also now start complaining of upper right quadrant pain. The yellowish discoloration of the eye. Okay. But for the signs, you come inside. So when in cases of late detection, when the complications have already set in, they now start having distended tummy. Yes, some people, as part of the signs, symptoms will come with bleeding tendencies. Okay. They visit the washroom and they notice that there's blood in the stool. They usually dark in color. They would vomit and they notice that it is bright red. Okay, so these are all. Some people also will present with confusion. Okay. Yes, when there's a lot of bilirubin crossing the blood-brain barrier. So these are all signs and symptoms that the patient can present with.
Okay. So maybe the person is presenting with these things. Is it likely that it can be reversed?
You mean the signs and symptoms or
the damage to the liver itself?
Okay, so it depends. Okay. It depends. If you are talking about some of the conditions are reversible, especially those which are drug-induced. Okay. If you're able to stop the medications, do some form of dialysis to eradicate, and give the antidote for the medications, the liver can return to its form. In the case of alcohol too, alcoholic liver disease is one of the things that we say if you stop alcohol, the liver will go back to its original position. Let's not forget that the liver is also one of the few organs in the body that has the ability to regenerate on its own. Okay. Yes, so usually we talk about healing, you mentioned regeneration, you talk about repair. The repair usually will come with fibrosis and all those things, formation of fiber tissues, thickening and all that. But the regeneration, they come back to its normal with normal production of the cells. Alcohol can do that. But unfortunately for hepatitis B and C, that is what makes it a bit severe. The liver is not able to regenerate because it takes over the liver cells. Okay. It affects the hepatocytes itself, the liver cells itself. So the ability to regenerate is impaired. That is what makes hepatitis B and C difficult. So for hepatitis B and C, regeneration may not be possible. Healing might lead to cirrhosis, fiber formation and all that. But for the others, as I mentioned earlier, there's a possibility of regeneration, yeah.
Okay. But apart from the signs and symptoms that we've mentioned already, how do we confirm that someone has liver disease?
Okay, so you come in with your symptoms, we pick up your signs, we think you have a liver disease. But the next thing we'll now go to is trying to confirm, as you mentioned. Yeah. So basic test to be done, what we call a liver function test. The liver function test has many parts. The bilirubin levels, issues dealing with some amino acids which are released during the breakdown of the cells. When they go into high levels, we suspect that the liver has been affected. We test your clotting profile because we are saying that the liver has the ability to produce some sort of clotting factors. So we check your clotting profile or your ability to clot. If you notice that the time limit is more than we expect, then we know that there's an issue with your liver. To some extent, we also do what we call ultrasound.
Okay.
Yes, the ultrasound will look at how the physical look of the liver through ultrasonography, and to some extent, we can also do liver biopsy to find out.
Okay.
Aside that, we now test the individual causes of the liver. So, for example, we test for hepatitis B, hepatitis C, HIV to see if it could be positive or not.
Okay.
Yeah.
Okay. So when we are talking about liver disease, most of the time we look at alcohol, and then the next thing is hepatitis. What is hepatitis?
Okay, so when we talk about hepatitis, all we are saying is the diffuse or patchy distractions of the liver, or inflammation of the liver, in simple terms.
Okay.
So inflammation, I don't know how to put it, but like there's injury to the liver. That's basically that's hepatitis. Do you understand? So what is causing the injury to the liver is what makes it different. So you can have alcoholic hepatitis, one which is caused by viral hepatitis, autoimmune hepatitis. So based on the cause, we add it to the injury to the liver. So when we say hepatitis, all it means is that, in simple terms, injury to the liver.
Injury to the liver.
Yeah.
Okay. So earlier you mentioned hepatitis A, B, C, D, E. So that's like 5 types.
Yes.
Okay. How do we get it?
Okay, so it depends on. So hepatitis A usually is fecal-oral. When we say fecal-oral, feces oral.
Okay.
So it means that you are eating feces. Sorry for saying that.
Okay.
Do you understand? You are eating feces. That's what, in simple terms, that's what it actually means. Yes. The good thing about it is that it is usually treatable. The hepatitis A. Good.
But how does that come about? Eating feces. It's not like something we would usually eat. You will not eat that. So how do you?
So hygiene. Okay. The water you take, the food you eat.
Okay.
Basically that, just like the way more or less we say cholera presents. It has a similar thing like that.
Okay.
Hepatitis E also is like that.
Okay.
It's also
fecal-oral,
right?
Okay.
Yes. The B and C usually comes as a result of sexual intercourse and also exchange of body fluids and also blood products. Do you understand? Basically, that's how they present. Yes.
Okay. So there are 5 types. Why is Hep B such a big deal? That's what we mostly hear about.
Yes, because hepatitis B and C affects the liver cells itself.
Okay.
You understand? They are pathophysiology in such a way that they affect the liver cells and they take over the function of how the liver cells work. So at the end of the day, the liver cells are not supposed to perform its usual function.
Okay.
That's what makes it dangerous, difficult. The others are not like that, but for hepatitis B and C, the target is the liver cells itself. Yes.
Okay. Is there any relationship between any of the types, like hepatitis B and D? Is some form of relationship there?
So hepatitis B and C usually will present almost like, usually you have co-infection between hepatitis B and C, but usually you also have that. We notice that people who have hepatitis B also have hepatitis D.
Okay.
Yes. Reasons I can't really tell, but it's something that we usually see a lot. Yes.
Okay. And there's a lot of stigma with hepatitis B. So you mentioned sexual practices and then bodily fluids. Is it possible that you can get it? Someone has it and they're sitting beside you. Can you get it through that?
No, it's not something. So the myths, people say a lot of things. Like when I sit by someone who has hepatitis B, I'll get it. It's not true.
Eat
Someone will
with the
say if I
same
eat
spoon.
with the spoon, those things. Some will say that, especially you do notice that all of a sudden someone is sick, he has a big, how do you call it, tummy. Then you have people say that, even is saying diabo. So these are some of the myths. People are saying it is transmitted through mosquito bites. These are all some of the myths which are all not true. Yes.
Yeah. So who is at risk of getting it?
You and I are at risk of getting hepatitis B because of more or less our hygiene levels. Yes, one, the fact that you have now, especially most young adults who are engaged in unprotected sexual activities, they are at risk of what? Hepatitis B. When an exposed, how should I put it? A mother who is exposed to hepatitis B, if there's exchange of body fluids, they are also at risk of. Yes. I said obesity is also a risk factor.
Yeah.
Yes. People who are engaged in illicit medication, sharing of needles, using sharp objects which are unsterilized. These are all those group of people form those who are at risk of hepatitis B.
Okay, so you've mentioned a child who gets it from their mother who is infected. Is it common practice to test babies when they are born for hepatitis B?
So what usually we do is that when you test, there's a high probability that at birth when you test, you might not really see anything. So, but what we do is that we try to prevent the child from getting hepatitis B.
Okay.
You understand? So you can have a hepatitis B positive mother giving birth. We will allow you to breastfeed as usual, but we try and protect the child from getting it. We do that by doing two things at birth. One, we give you the vaccine.
Okay.
And two, we give you the immunoglobulin.
That's to what, the mother or the baby?
To the baby.
Okay.
The vaccine and the what? The immunoglobulins. They give the two to the baby at birth. Then at 6 weeks, the child will now continue with his usual EPI. When I say EPI, the expanded program of what? Immunization. The scheduled vaccinations that we take to community health centers for the kids to do it. So at birth, they give the vaccine, they give the immunoglobulins. Then at 6 weeks, you continue with the usual schedule, which is 6 weeks, 10 weeks, 14 weeks for the pentavalent vaccine, which are 5 vaccines.
Okay.
One of them is hepatitis B vaccine.
Okay. And it works fine. The baby won't get infected.
Yes, most likely, yes.
Okay.
Even if it's there, because of the high levels of at least for the next 5 years, because of the high levels of the immunoglobulins, you can keep the viruses at bay and also at more or less undetectable levels.
Okay. So I'll come to Francisca now. So with your foundation, spreading the message about hepatitis B, what have you achieved so far with that?
Okay. So when we go out there, when we start these conversations, you get a lot of people calling or texting. Sometimes some of them contacting you through social media, and almost all the time they have one question: is there a cure? Is there a cure? Everyone keep asking, is there a cure? And doctor has spoken a lot about how you can live with hepatitis B and still, live a normal life. And as heartbreaking as it is to tell them there is no cure, but it can be managed till your viral loads get to the undetectable level. Yes. And I think for most people that we have engaged, it brings some kind of acceptance. And also they start looking at the right places. Before, when you talk to them, you realize they are telling you stories about some herbal medication that have promised to cure them of the virus, and some of them are telling you it's abonsamiare, yatoamau. And then when you talk to them and encourage them to go out there and seek proper medication, it brings them some kind of relief and hope. When we started, we've tested about 816 people. We had the first outreach in 2021, which was the 1-year anniversary of my late father. The second was done last year, and both at TEPA, one at the senior high school targeting the students and the staff members, and the other was in the community itself. And for those who unfortunately tested positive during the projects, we referred them to the health team. They advised on the next steps to take, and then we follow up with them. And so far, the acceptance that the infection is not abonsamiaria, so to say, is coming to bear. Now you talk to these people and they have some kind of hope that if I'm taking my medications, if I'm living a healthy lifestyle by eating well, exercising, and drinking lots of water, clean water, of course, I am at I have the high chance of living a healthy, normal life. Yes.
But you mentioned outreach. How are you supporting these programs?
So, since the birth of it was based on in honoring the memory of my father, family and friends have been supporting it, and of course, a chunk of it will come from the idea behind it. So, when we go out there, it's kind of a part of us we're giving to the world. But it's getting bigger. People are asking for more conversations on the people are asking us to do more outreaches, moving it away from the annual program to probably quarterly program. And these things are
it's all money. It's all money.
It's all money involved. So when we are having these conversations, we are also advocating that well-meaning Ghanaians would show interest and support in any way they could. And especially the health professionals. We cannot do this on our own. We need you. Like we're sitting here right now, there are a whole lot of terminologies he can use, and he can understand better when patients talk to him than they would when they speak to me. So that is also another support that we are advocating we would get.
Okay, but for financial support, if someone wants to help, how do they help?
The person can contact us through our social media handle, Collins Healthy Liver Foundation, or Cliff_GH, Cliff CHLIF_GH. When they send us a message on Instagram, we would respond. Also, an email can be sent to us, cliffgh cliffgh@gmail.com. Or call on 0248 459 555.
Maybe you can just repeat the number again.
0248 459 555.
Okay, right. Thank you so much.
Thank you.
Right. So, Kweku, we mentioned the signs and symptoms for liver disease in general. Do they apply for hepatitis as well?
Yes, they do.
Okay. And then is there a way to prevent the infection of hepatitis?
Yes, so as I mentioned, the role of the vaccines and the immunoglobulins.
Oh, I thought that was just for the babies.
No, so adults adults who have tested negative have the chance of being on the vaccine to prevent at least for a 5 to 10 year period. To prevent yourself from getting hepatitis B. Usually the vaccine comes in it's about between 30 to 50 cedis. It's not too expensive. You take one on a day one, then you take the second one I think after a month, and then the third one after 6 months. Yes. You can do that. You can do that, and I think you should be okay. The other thing is also, as we mentioned earlier, is trying to prevent the risk factors, as we mentioned. So protect yourself, avoid alcohol intake, avoid the use of sharing needles and stuff.
Does the vaccine cover all the different types of hepatitis?
Oh no, usually mostly it's target specific. The common ones in the market now is hepatitis B. Vaccine,
So how will we diagnose someone with hepatitis B?
So hepatitis B is usually, it's a serology test. So you do usually we use the test kits, the antibody test kits for hepatitis B, where you have 3 marks. We have the control T1, T2. If it's positive, we do that.
So that's like the malaria kit.
The malaria kit, more or less, yes. What they will do is that if you test and it is positive, then now they go further, then they do what we call the viral load. They do the first test, it's test positive. The next one, they do the viral load. So you look at the quantity of the viruses in the system. Let's not forget that earlier I mentioned that the role of the medications are there to push the medications to undetectable levels. So based on the viral load, we're able to track whether the treatment is working or not. The third thing we also do is that aside the viral load is what we call the hepatitis B profile. So the profile will tell us whether it's an envelope antigen or an envelope antibody based on the structure and how far advanced the hepatitis virus has affected the liver. Yes.
Okay. So does it mean that when I get the vaccine, I can get the hepatitis B infection?
At least for the next 5 to 10 years, you may get the virus, but even if you have the virus, you are not in a position to have a clinical manifestation of the disease.
Okay.
Do you understand? Yes.
Okay. So I didn't know there was a vaccine, and I have the hepatitis B virus now. So what happens to me?
Yes. So what you do is that as I mentioned earlier, we check your viral load to know the amount of viruses. We check your hepatitis B profile. Then now you see the public health team is usually the public health team and also the gastroenterology teams of most of the hospitals are the one which see patients on that. Then they will put you on the antiviral medications available that are there to bring down the viruses. Let's know that it will be of note that these antiviral medications are free and are not sold on the market. They are, because it's a public health concern, so it's government sponsored and the medications are available.
Okay.
Yes.
Okay. But for the vaccine, let me just take you back a bit. Where can we get the vaccines?
As I mentioned, most of the public health departments of most of the hospitals, they usually would have the vaccines available. Wherever you expect them, they do normal vaccinations, COVID vaccination, yellow fever vaccination. They should also have the hepatitis B.
Okay, so you can just walk in.
Exactly.
Okay, right. Thank you so much for that education. We'll go for a quick commercial break, and when we get back, we'll continue with the conversation. But please do send in your questions and comments. We'd love to hear from you. Please stay tuned.
I am an angel of hope.
I'm an angel of hope.
Ubrenio, so do Sika a Baba Hope channel. No, so ya sene. Yet me the mere some a main chia saw in Choromina or Daroma. Farmain, Nafa Sika Fasubi, na also Fabra, Yanko Kanyamsem, and ya cra a wonqua. Star 928 star 34 star 104 hash. And I say 0249 193083. Hope channel, yes, it's Sabrabo. Hope channel, yeah, Gia Cranomqua.
Hello, dear one of the inspired writers of our time, Ellen G. White, in one of her books, Testimonies for the Church, Volume 9, page 11, says, the agencies of evil are combining and consolidating their forces for the last great crisis. And this indicates clearly that we are in a serious and messy situation today in our world. We're looking forward to the second coming of Christ. Hence, we need health reformation and revival today in our time to get us fit for the accomplishments of God's word. I call you to be with me from 9th of July to 15th of July, 6:30 p.m. exactly. And I will take you through, and we shall all be together to study the word of God from the biblical perspective, how healthy we're supposed to be. And I, Dr. Maurice Mensah, will be sharing a lot more with you. May God's peace be upon us. Amen.
Welcome back to the consulting room. We are talking about healthy livers today. So with me, I have Dr. Kwekwe Nyumedu and then Francisca. So Francisca has a very special organization and they are promoting healthy livers. And we're doing just that today to raise awareness on how to make sure that you have a healthy liver. And if you have any infection such as hepatitis B, what you can do about it. It's not a death sentence. So Francisca, since you started this foundation, I'm sure you've read a lot about hepatitis B and all the other infections, but how do you think the society can better support people who are living with hepatitis B?
Okay. All right. So first of all, everyone needs to understand that sitting next to a person with hepatitis B does not make you a high risk of contracting the infection. Also, we need to stop telling people that we need to go somewhere else. The doctors cannot solve this infection. Try this herbal medicine. Try this medicine. We need to accept that people living with hepatitis B is just like probably any other viral infection. We've had a lot of conversations on HIV/AIDS, and I believe people are beginning to grasp the essence of removing these stigmas from people with hepatitis B. Also, I think that for policymakers, more resources should be channeled to promoting liver health and hepatitis B. Also to encouraging people to get tested. That has been the main focus. Get tested, because early diagnosis is the best way to go. When you are diagnosed early, then you can start with the necessary treatments, then you can live a normal life. So we are advocating that a lot of resources should be channeled so that a lot of research could be done and a lot of people can get the message. Vaccination, we saying, should be free. It should be free because we wish that everyone would get the vaccines. It would give us, at least it would take a lot of burden from the doctor, from us, and the fear of a loved one leaving us would, through hepatitis B, would be kept. So if vaccines are free, then we can be able to, eliminate this deadly disease. And for our health professionals, we also advocating that you ask further questions when we come to you, ask deeper. If probably we have all this at the back of our heads, like in most cases, when you go to the hospital and you are suspected to be sexually active, an HIV test
is done.
So let's add this to the screening we do when somebody comes to us complaining of any of these symptoms that are also similar to many other diseases.
But for your foundation, do you offer vaccination to people?
We offer vaccinations, but we are unable to foot that bill for our participants. So we do that in collaboration with the nearest hospital to the location we go to. And for this particular year's outreach, we are doing it with St. John's of God Hospital at Duankwanta in the Brahafo region. So their health professionals will come around with some of the vaccines for participants who will be interested in taking it. And we are encouraging all participants to get the vaccine. It's not expensive. From what I hear, it's the price per shot is between 30 to 50 cedis. Yeah. Something can be done about it. And it also forms part of the goals of the organization, that as time goes on, we would be able to offer free vaccinations during our outreaches. Yeah. Or even if foot the complete bill, we would be able to subsidize it. Yeah.
But how do you choose the venues for your outreaches?
Because it all seems to be okay. So I grew up in Tepa. Okay. That's where my parents lived. Okay. And my father, my late father, had a lot of impacts in the community, in the church, in the society. He was quite a known person. Okay. And when I had to honor his memory, I thought that charity begins at home. So the plan is to cover all the communities around Tepa. Okay, okay. Because I realized that there are a whole lot of misconceptions, the myth, the beliefs we have when people start exhibiting hepatitis symptoms. I mean, that has always been the first resort, so let's see a fetish priest. I want us to be able to take that misconception out. When people accept that not all diseases are demonic or evil, we will take the right step. That has been my advocacy. We need to know that, fine, we are Christians, we believe that when we are going through certain difficult times, we should always fall on God, and that should be always falling on God. Whether we can have a cure to it or not, we will definitely go back to God. But God has also blessed us with knowledgeable people, expertise, to help us through these ailments. So why don't we fall on them while we pray? So for some people, they end up in church houses instead of going to the hospital. And that is what people need to stop. My people, we need to understand that this thing has to stop. It is not abonsamiare, it is medical. And though I encourage that we pray, we also need to seek the right medication when we find ourselves in this.
So when is this year's outreach happening?
This year's outreach is happening on 1st July 2023. And we are going to Maban Senior High School. Maban is in the Ahafano North Municipal in Ashanti region, close to Tepa. So this year we're targeting the students, the staff, and we've also targeting the community to come around. We have more than 20 health personnel who are coming on board to support, to help with the testing, the vaccination, and also the counseling. And we are not only doing testing for hepatitis B, we are going to test for blood sugar levels, BP, and all that. And each participant would have a dedicated doctor to speak to after the results are out. So they teach you or they tell you exactly what to do. When we find out you are hepatitis B positive, we refer you and then we take it up from there. We use our network to help you go through the proper medication and seek proper care.
Okay, great. So Kweku, you have the infection. What could happen eventually if you don't get treated?
Okay, so when you don't get treated and your liver cells, as I mentioned earlier, begin to get destroyed, the liver gets fibrosed, or there's fiber thickening of the liver, and that's what we call liver cirrhosis. So liver cirrhosis itself is a complication. You may have what we call even hepatocellular carcinoma, liver cancer can be a complication. Formation of ascites can also be complication.
What's ascites?
Ascites, the standard abdomen.
Okay.
Yes,
okay.
and also the bleeding tendencies like upper GI bleeding from bleeding tendencies can also be a complication of the liver disease, and also reversal of most of the normal functions of the body in terms of glucose storage and all that.
Okay.
Yes.
Okay. So Francisca has mentioned already that people tend to seek herbal intervention instead of coming to the medical doctors. What does herbal medication have to do with it? Does it have any effect on the disease itself?
Okay, so herbal medication in general, this question you're asking me, I'm trying my best to be diplomatic in my answer. Okay, however, it's good, right? But the only thing is that we are talking about moderation, okay? And you knowing the quantity that you are taking, because usually herbal medication in itself, if it is toxic or it is not prepared well, might affect the liver parenchyma. You may not know where it is coming from.
Okay.
So it's always best that you can tell the source, the kind of plant-based medication you are taking, the quantity that you are taking. Because even a normal orthodox medication that we do, there are situations that we tighter the dosing.
Okay.
To some extent, we say, okay, your liver is getting deranged, so let's reduce the strength of the medication we are giving. To some extent, we'll say let's increase it. The other thing is also the interaction between medications, which 2 or 3 medications which are taken at the same time, which usually occurs at the liver. Some herbal medications predispose other medications into either increasing its severity or decreasing its severity. You might not really tell what you are taking. So these are reasons why we should be mindful of what we take here.
Yeah. So earlier you mentioned that if sometimes when you test, you might not test positive, but actually there might be the virus there. So after how long does the virus have to harbor in you, and then after you test, it will be positive?
Okay, so usually it has an incubation period of about 3 weeks.
Okay.
Yes, 21 days thereabouts. After the 21 days, you begin to experience symptoms. So tiredness, fever, upper quadrant pain, nausea. Then it resolves.
Okay.
You get better. Do you understand? Because now the viruses now go back into hiding, or the initial immune responses have worked, so the viruses now go to sleep, and then they resurface again and they attack your liver.
Okay. So there's a question. Let's just deal with that now. An interesting discussion there. Can one be predisposed to liver disease due to hereditary factors?
So hereditary factors, yes. Some liver diseases are hereditary.
Okay.
Hemochromatosis, iron deposits, Wilson disease, copper deposits, and some others might be hereditary, but not hepatitis B and C.
Okay.
Yes.
Okay, so that's a follow-up question to that. So if so, is there a test one can do to ascertain this predisposition in order to live a healthier lifestyle?
Oh, the current medical knowledge has gotten to the point where people are now looking for genetic tracing and telling that I'm predisposed to this, so I want to avoid this possible.
Yeah.
You know, recently what Angelina Jolie did with breast cancer.
Yeah.
Yeah. So these are modalities that are taking place, but it's not. You try and avoid it because it's not something which is very common in the system that you should be worried about trying to look for your genetic predisposition.
Okay. That's another question. Good evening. God bless you for your insightful program. All the 6 children of my parents are all Hep B positive, though none of my parents have the virus. What could be the cause?
So most likely, maybe lifestyle. Is something they are exchanging body fluids when you are not sure of yourself. I mentioned that especially the razor blades that we use. You understand? It may also be a natural phenomenon. You can't really tell. I mean, that's in terms of it's happening not because you are doing anything wrong.
For the Hep B?
Yes. What I mean is that it may not necessarily that you cannot. It may not be in a position where you can establish a link that you are all doing this, and that's the reason why you are all having it. It may have been individual predisposition to the virus, and I'm saying, however, it might be very easy for you to be too comfortable with somebody. And then you end up exchanging blades. These are all things that. So it's a matter of you trying to avoid the things that predisposes you into acquiring a virus.
Yeah. Okay, so I think this is for Francisca. Also, I would be happy if your foundation can assist me to fight this disease, because things are quite difficult for me now. I'm sure the person can reach out to you.
The person can reach out.
Yes, so whoever this is, you can reach out to Francisca on their various social media platforms that she's mentioned earlier, and I'm sure she'll be willing to help you. Okay, so with the counseling Francisca mentioned earlier, when they come to the hospital and they test positive, what counseling is available for them?
Okay, so usually your practitioner would tell you what you have and will take you through your treatment modalities, things that you can do to help you live a better life. Usually what we also do is that when you are referred to, since the people have a psychological approach to when they hear such bad news, so usually we will refer you to the clinical psychologist who will now take you through the condition. When you go to the public health department too, they will also take you through the condition, why you should take the medications, the benefits of taking medications. So we, at every level, there is some sort of pep talk that goes on between the practitioner and the patient who is sitting there, just to prepare the person into living with hepatitis B.
Okay. But is it everyone who would need medications?
As I mentioned earlier, if you have hepatitis B, you will need the medications. You will have to be put on the antivirals. But to some extent, when we notice that the viruses have gotten to undetectable levels, we could either reduce the dosage, or we may decide to, we may ask you to put it on hold until we notice that it is. But we'll still be doing periodic check of the viruses just to make sure that they are there.
But this is not the decision of the patients. They have to come to
the hospital, exactly.
Right, okay. Thank you so much. I don't know if you have any final words. Maybe we'll start with you.
All I can say is that currently about 2 billion people in the world are living with hepatitis B. And now they always say that 1.5 million cases almost every day. However, just 10% of people are tested. It tells you that the number of people testing is still very low.
Yeah.
So I will entreat viewers that go out there, get tested. Hopefully you will test negative. When you are negative, go for the vaccine so that you do not have to stress yourself with hepatitis B.
Right, thank you. Francisca?
Hi.
Any final words?
Yes. So for people who have tested positive for hepatitis B, I want to encourage you that it's not a death sentence. Steps can be taken to help you live a normal, healthy life.
Yeah.
Go to the hospital, talk to your health practitioner. They would help you. And for this, we have started this foundation. We would encourage all people, everyone, to come on board. In any way you can support us.
Yeah.
Please come on board. Let's have this conversation really loud. It should be in people's ears. People should just know when we mention anything hepatitis.
Yeah.
So we are encouraging others to come on board. Please get tested. Don't be afraid. Get tested, get tested, get tested. Thank you.
Thank you. Thank you so much for coming and raising awareness. It's such an important topic. I'm sure you've learned a lot tonight, and my guest has said it all. Let's get tested. If you are negative, try and get the vaccine, and it will save you a lot of trouble. If you are positive, it is not a death sentence. Please seek medical intervention so that you can start getting treatment early enough to avoid every complication we've spoken about here. And also, Cliff GH is here to create awareness and also help people who have been diagnosed with hepatitis B. So if you have anything you'd want to support with, please do well to reach out to them on their various social media platforms and their numbers as well. And I'm sure you'd be able to touch a life of someone who has hepatitis B. Thank you so much for joining us, and we hope to see you again on our next show. Have a good night.